Have you ever felt overwhelmed with all that's going on in the world? Sometimes we don't realize that we can make a difference. My name is Debbie Van Grieken, and it is my hope to inspire you to take small steps towards social impact. Join us each week as we have conversations with those who have taken simple steps towards living a more sustainable and socially conscious lifestyle. If you want to make social impact, let's start small. The Small Steps podcast is proudly sponsored by Moya Shea Products. As a listener, enjoy 15% off your online purchase. Use code SMALLSTEPS15 at checkout. At Moya, we believe in people helping people. Supporting the local and global communities that help our organization succeed is very important to us. We apply a fair trade framework when purchasing raw materials, supporting farmers and families. Thinking global and acting local, Moya works with organizations to better the lives of children through education and fair trade. Are you looking for the best moisturizer for beautiful, healthy, glowing skin? Our Shea products are superb moisturizers and have exceptional healing properties for those suffering from skin issues. Check out these products and our wellness line at moyasheabutter.com.
Welcome back to Start Small, Small Steps to Social Impact. Today I'm happy to be joined by Dr. Reza Kazemi. We are going to be discussing the plant-based diet for health and sustainability and the wonderful work Dr. Kazemi is doing to educate others. Dr. Kazemi is a graduate of the University of Toronto Medical School and has been practicing medicine in Dunnville, Ontario, Canada since 1988. In 2001, he and his wife, Dr. Barbara Kazemi, created Agents of Change to promote fair trade and raise awareness on the unfair international economic system as the root cause of global poverty. They began the DREAM program, Designing Routes to Education and Mentorship, and a global literacy program that helped high school students live in a Mayan village in Mexico to learn more about the root causes of poverty. In 2010, they founded Triple Bottom Line for Sustainability, Inc., a not-for-profit organization to act as a platform to promote environmental and social fairness. It is the parent organization of Shared Harvest Community Farm, which offers sustainably grown food to everyone regardless of income. They also opened the Minga Cafe and Community Center, which offers environmentally sustainable and socially responsible prepared meals to the community regardless of income. Shared Harvest Farm offers a weekly produce box at a cost below market prices. Additionally, their Let's Eat Right program offers the same size produce box at 1/3 of the price to anybody who self-declares as experiencing food insecurity. The Minga Cafe offers prepared meals at a cost substantially below market prices, and the Pay It Forward program offers the same meals free of charge to anyone who declares as experiencing food insecurity. I have had the privilege of volunteering on these projects, and it has had a profound impact on my life. I am grateful and honored to call Rez and Barb my friends. Hi, I'm so happy to be with you here today, Doctor. Thanks for joining us.
Thanks, Debbie. I'm glad to be here also. Thank you. I listened to one of your podcasts with Hayden, and I was so impressed. Well done. Like, it's wonderful. I love the theme, the energy. Everything was perfect. Very nice. Congratulations, Debbie.
Thank you. Yes, that was a podcast for our listeners who are joining us. That was the one I had with my son. So it was a great podcast, and we've had a lot of positive feedback, and he was really happy to hear that too. So thanks for that. But today I really am excited to have you here because this is such a topic that it's pretty big and it can get a little overwhelming. And I know for me personally, it's been a topic that I get a little disheartened because I've watched a lot of documentaries. We've seen the things coming out about plant-based diets and sustainability and the environment and our health. And there seems to be this huge disconnect. So, we're going to fundraisers for cancer and they're serving us hot dogs, and, we're going to, different events and they're giving us dairy and it's a heart related event. So, for me personally, this is a challenge. My father, who broke 3 hours in the Boston Marathon, climbed Mount Kilimanjaro, died at 62 of a massive heart attack. So this is something that for me, my health and as well as sustainability, I want to look at this
this diet. So maybe you can talk to us about some of that disconnect that you've seen, and how do people, regular people without the medical degrees, how do we figure this out and get a little bit of control back?
Yeah, I mean, Debbie, you're talking about total confusion, and what you just described in our schools or in going to fundraisers for cancer, and then they serve you hot dogs that is known to be carcinogen. It shows total confusion among the professionals who are organizing these events. And we see it even in our current environment. They keep talking about this polarization of society and right and left, the anti-vaxxers, but when you look at these people, the problem is not polarization. The problem is that we have lost trust in our institutions. We have no trust in our institutions, and rightly so, because we have seen that our institutions are hollow. And the big picture, is to look at where it comes from. I can maybe find the source at this notion of deregulation that was promoted since 1980s with Reaganism and Thatcherism. When we talk about deregulation, it's just a word. But then 40 years later, the result of deregulation is weak standards, weak oversights, and to the point. I mean, I used to watch documentaries that talked about how during the Bush administration, the Environmental Protection Agency heads were Monsanto's retired people that would go and become Environmental Protection EPA. And then once they're done, they go back to Monsanto, and during their reign, they would weaken all those protection that was supposed to be afforded to society. During the last administration in the United States, that's gone one step further. President Trump chose someone to be head of EPA who was against the EPA altogether. So those deregulations goes on Monday, Reuters reported that the EPA fails to even measure our pollution in the air because either the machines are not working or they are placed in places that there's no pollution at all. So they have failed to even measure the amount of pollution they're supposed to measure. So here we are, 40 years later, are left to our devices to decide if the vaccine, for example, that's going to be given to us, or the food that is Subway, is it safe for us or not? Of course, we know some of it's not. For example, a citizen found out that they add plastic to Subway bread to make it fluffy. Right. And it wasn't an organization it wasn't an institution that discovered it. It was a citizen who discovered it and raised the issue, and something had to be done. So the problem is that we cannot expect average people to be chemists and scientists and nutritionists and doctor and lawyer to decide whether they're going to go to a restaurant or not. We really need to strengthen those institutions, and that's the problem. The problem is that those institutions have been weakened. So this is what we see right now, that there's a total lack of trust in our society toward our institutions. And that lack of trust is what you're seeing in all facets of whatever is happening, and to the point that we like to divide people into us and them, anti-vaxxers. But among all these people, these are people who are they're just saying that we don't trust. We just don't trust the science because the science is not being vetted by institutions that are supposed to protect us. On top of that, we are bombarded by commercialization. I remember when my kids were growing up, we used to love to watch Arthur, and I used to sit down with my kids, watch Arthur.
I love that one too.
I used to love it. And, it was terrible because every 5 minutes the commercials would come on, and the commercials were either McDonald's or Burger King or, some fast food that would brainwash our kids to consume highly processed food. Right. And this was done knowingly that, between 4 and 6, the kids are watching. All the commercials were targeted at them, again, without any regulation to protect our children against brainwashing. So again, this is what big picture policies that are set in motion by certain agenda, how it influences our everyday choices today. And then we see many shortcomings in our society, and then we don't know where to turn. Exactly. So those are the big picture things. So, you and I have been trying our best to navigate and try to help ourselves, and as well as our society, our communities, to stay healthy. I've read a lot of books to what to do, how to answer your question. Some books lately, talk about, the idea is not to change light bulbs helps, if you want to help the environment, is change your leaders. But the problem is that what about if our leaders are also under the influence of big money?
Right. We've seen that there's a lot of, money being exchanged too, and that you follow the money trail as well, that a lot of these big corporations and stuff are influencing our leaders to make decisions.
And not only our leaders, but ourselves,
Yeah.
There was a perfect example was, it was a movie, the documentary called Human Experiment, where there was this fire retardant chemicals that were known carcinogens, and they were being put on everything. And in California, they tried to remove it because they said, what's the point of having fire retardants on pillow where we put our baby's head on the pillow and they can get cancer? It was an easy win, democratically. But the chemical companies spent enough money and did wonderful, in their perspective, a wonderful campaign. And the end result was that motion was defeated by the people, by the public in a fair election. So, the big money, certainly we can always say it can influence our leaders, but it certainly can influence us also because we are influenced. So now, in an environment that we have to question our own opinions, so what do we do? How do we navigate, And, my understanding is, we have to come up with our own authentic rules, we have to come up with some rules of engagement. But before coming up with the rules, we have to understand our humanity. Our humanity has certain attributes. We like to put ourselves into groups, take ourselves, we like to be part of a team. So very quickly, the team mentality creates the us and them, because the us, we can have protection, but then very quickly we can identify someone else as them. But also we tend to like to have more, again for our own protections. Those are our basic human traits that we are hardwired for. And we have to recognize that, because if we don't recognize it, we cannot moderate it. I can give you an example of how our brains work. Maybe it fits, maybe it doesn't, but I was just thinking about it this afternoon. Something I heard, in the East, when they want to catch monkeys, what they do is that they take a coconut and then they put food some sweets in the coconut, and then the monkey can put his hand straight to grab that sweet. But once he makes a feast, he cannot get his arm out of the coconut. But the monkey always gets stuck, and that's the trap. That's the trap. Right. So, of course, we think that we're not monkeys, but unfortunately, my experience has shown that a lot of times we are grabbing that sweet, that thing that we are comfortable with, that thing that we desire. And then even though that thing can hurt us, can imprison us, it can take our life away, we keep holding to that thing, just like the monkey in the coconut. And that is what I've experienced in medicine, for example, which is very disappointing because, you're dealing with people's lives, and where we see people can change and protect themselves against another heart attack and a stroke. My numbers, even though I was very passionate about it and I tried to explain, was maybe 1 in 10 would take it on.
Right. 9 out of 10. The hard thing is convincing people to let go of what they're doing.
The sweet, the hand stuck. The hand is stuck in that coconut with the sweet in their hand, and they just cannot let go. So the question is, how do we overcome that? Those are our basic instincts, right? So I'm not judging the person who doesn't follow what I suggested to them, even though that their legs depended on it or the heart depended on it. But I realized that that's our humanity. The question is that how can we transcend? And that's the beauty of our humanity. The beauty of our humanity is that we actually can. Maybe monkeys can too, but I'm not sure. I don't know. I know we can, but it's not something that is natural to us. It requires a lot of reflection, just like what you have done. I know for you, remarkable what you have done. I'm so happy to know you, Debbie, for what you have done in the past 10 years. And have changed your career altogether. But again, it wasn't easy. I'm very sure you had this very stable money earning career before, and you had to change that. But you didn't change it just because you want to change. You changed it because you reflected on an idea. You ask yourself, how can I make my life authentic the way I want it to be? And then you created some rules, around that. Again, humans, we need incentive. We need incentive. So our biggest incentive in our humanity is money. because we can measure it. If I make $1,000 and $100, I've done better. So because it's such an easy thing to measure, we are all addicted to it. But then, I'm very sure when you would decide to change your life direction professionally, and you just said, okay, money is a part of it, but I'm going to take it as profit, my impact on people, on the 5,000 women who get me shea butter and collect this organic, wonderful East African shea butter. And that is my contribution socially. And I can measure that. I can say, if I'm selling 1,000 pounds of shea butter each year, I'm helping so many people. Right. So you have actually
tangible. You can see the
measured it, right? And that is part of your profit. You think of it. Every time you think of those 5,000 women, you literally, just like having $100 versus $1,000, you say, okay, I'm impacting a group of people who needs support. Also, you're very keen about organic. You say, I can get my shea butter cheaper if it's not certified organic, but I'm not going to do that. I'm going to pay more to ensure that the environment is protected. And again, is a profit. Is a measurable profit toward environmental sustainability. So Uganda, where your shea butter comes from, remains a less polluted environment. The soil is protected, the waterway and the air is protected. So these are all something that you have taken in as profits, not only financial. I'm very sure you've given up a lot on your financial profits.
Oh, yes.
In order to have social profit and environmental profit. Right. And this is what we have to internalize, because our society, we are humans. Our humanity is based on numbers, is based on incentive. You need some incentive and something that we can measure. It's very hard for us to just some abstract idea that I'm helping someone. It's hard for us to do that. We function better if we can have some measure.
Obviously there's this shift that has to happen in our thinking, but I think it shocks me still that, you're talking about people whose health depends on it. You mentioned, people whose heart or legs depend on switching to a healthier plant-based diet, and you would think the incentive would be there. I get that there's this disconnect, but how can people start taking small steps to get on the right path, and that they see the goal, they see the incentive, they know that it's a longer life? What can they start doing? Because it's still baffling to me that still, I know, we've talked before that you have patients who you literally have seen this huge dramatic change in their health when they've switched their diet, by pulling strings and convincing them and kind of pushing them where they don't want to go for some reason.
Right. Yeah, absolutely. I mean, the point is never to give up. You never give up on people. I think it was a neighbor of yours that had heart failure, and really it took 26 hospital admission. And I'm not exaggerating. 26 times he was admitted gurgling because he was in pulmonary edema or fluid on his lungs because of heart failure. And on this 26th time, he eventually accepted to follow what we had created at Danville Hospital, which it was a healthy heart diet, which was at that time was all plant-based. And he literally, 5 days later, he saw the evidence, and maybe he was your neighbor. I'm pretty sure you remember what he did.
Yeah, it was funny because, he was bedridden and obviously, very sick. And then he switched his diet and he was out in the yard cutting the grass, hello. He would come over and he said, oh, that doctor, he's got me on that plant-based diet.
And, his wife was very, very kind, because he stood up at one time. She actually took the course in her cooking class and through the farm. And she, at the end of the class, at the end of 6 weeks, she stood up and said exactly that. She said, I used to hate you because every time you told me that you have to eat healthier, I was hearing that you were telling me that I'm not a good cook. Now I understand that you didn't mean that. You wanted me to.
Yeah, and I think because I had a conversation with her too, was we were talking about her switching to the plant-based diet, and it was there was a lot of guilt associated with it because she felt like she thought she was cooking healthy for her husband and her family, and she took care of them, did the meals and did all that stuff. And then to find out that some of the things she was cooking and feeding him was actually not good for his health. So there was that guilt and having to get over that.
So the good news is that, after the 26th hospitalization, he never been hospitalized again, and he lived another 2.5 years. He managed to go to his daughter's wedding and dance during that wedding. And that was really a highlight for the whole family. I mean, I received a letter from the daughter mentioning that again, how important that was and how grateful they were. And this gentleman who was, as Meg mentioned, was bedridden and was hospitalized. So this is something that can happen. So if there's anyone who's listening to your podcast, Debbie, who has heart failure, who has congestive heart failure is actual word, they literally can be helped. And the change happens within 3 or 4 days. The change of switching to a plant-based diet and the effect on heart failure happens within 3 or 4 days, as I've seen it many times when I admit patients into our hospital and they put them on, and if they agree, I put them on a plant-based diet. That's the change I see. To those of your listeners who have diabetes, I have an example of patients with a glycosylated hemoglobin. It might be a big word, but people who have diabetes know what I'm talking about. That's a test that you have to do every 3 months. And based on that, we decide whether the diabetes is under control or not. This person, his hemoglobin A1C, glycosylated hemoglobin was 9.3, and normal is 6. And within 3 months, he dropped it from 9.3 to 5.5. So it went from very diabetic, who any other physician would have put him on insulin immediately, to being basically a normal, healthy person after 3 months of plant-based diet. And then, again, those patients those people who are listening to your podcast know of anyone who have poor circulation in their legs, what's called peripheral vascular disease, where their leg is in danger of being amputated. It takes 6 to 8 weeks. I
actually recall a patient of yours. I heard him speak. So there was a gentleman who was he was in a long-term care facility, and he was at risk of losing his foot, I believe.
He was actually on the list for leg amputation.
Right.
He was going for leg amputation. I have 6 examples of that. 6 patients who were on the list on being an amputation list, who basically their legs were saved by changing the diet. And again, there's a lot of talk. I mean, we in our classes, we always talk about eating unprocessed, eating whole foods and non-processed food. But this gentleman, again, had no access to unprocessed food. So he was eating only processed plant-based food. And despite of that, his legs, with 6 weeks, the normalcy came back. He's red and shiny, poor circulatory feet completely went away. Remarkable. I mean, that was 2012, July 2012. I remember it because it was like, holy cow. I've never seen. I mean, I didn't even believe it. Right. I didn't even believe what I was seeing, that it can work. So it was just remarkable. That certain things you remember the date perfectly. July 2012, where. This gentleman literally had to cancel his appointment with the surgeon and say, no, thank you very much. I don't need the surgery. He lived 5 years after. But then the important thing is that it's not just an example, just not one person. Every single person that accepted to be on a plant-based diet, they managed to save their legs. And again, I managed to save 6, but there were many more. But again, going back to that example, they accepted to have their legs amputated, but not changing their diet, just like that monkey with their hands stuck. So it's not really, again, I don't blame people. I just recognize that that's the way we are. That's our humanity. Right. And the question is that how do we not change our humanity? We cannot change our humanity. We can't even feel guilty about the way we act, because that's our humanity. We can't even get mad, as a physician, I've learned not to get upset even, because I recognize that that's our humanity. And there are other areas that maybe my hand's in a jar in a fist form and I cannot get out because I'm stuck. Unless someone taps on my shoulder and tell me that your hand's in a jar and you need to change. And then I guess the steps are, first I need to reflect, and then I have to devise an authentic way of changing. And that authentic way of changing needs to be measured, needs to be in a measured way, because again, the way our brains work, we like numbers. We like, like 10,000 steps. That's what things that people measure are so popular, like 10,000 steps.
Yeah, so we have to get 10,000 steps in.
Right, exactly. So we have to measure. So we have a target, palpable target. And then we have to, hopefully, these are the ideals, just like you, we have to make that measurement not only to help us, but also help our society, our social responsibility, help our environment, our environmental responsibility, whether we can pay for it or not, you know? So we have to put it through these three filters to make sure that what we do is not only helping us, but helping everyone, you know, and everything around us.
You bring that up, a good point about the barriers that people could have to accessing this, you know, plant-based food and organic food. And I know you've done some work in our community, especially you have Shared Harvest Community Farm. And can you maybe talk a bit about some of the things that you've done in your programs to help with those people who have barriers and how you can help them to access healthy food?
Sure. So as you know, I think we have to go a bit further back, because that would make your listeners understand how I've arrived at this point, and also you know, it makes it more clear around that authentic path, and I think path that you have taken, and also putting everything through the filter of environmental stewardship and social responsibility. Well, you know, it all goes back to the DREAM program, you know, which we were a big part of it. You know, back in 2001, we started an organization called Designing Routes to Education and Mentorship. Take away the statistics that Danville had one of the highest was one jurisdiction with higher rate of students not finishing high school and a higher rate of teen suicide. So we started the DREAM program, and as you know, it was a 4-year mentorship program from grade 9, or is a 4-year mentorship program from grade 9 to 12. But the highlight of the program was the trip to Mexico. You know, every year.
Which I actually talk about in my first episode. So if listeners go back to our first episode, I do talk a bit about that program and the profound impact it had on me.
Right.
But yeah,
and me too, because it was called Global Literacy Program. And the idea behind it was to basically allow the participants, who were the mentors and our grade 11 DREAM students, to find their place in the world. So during that week in Mexico, we had 120 hours of workshops and sit-down classes and interaction with the Mayans. We were going to a small village, Ekbalam, in Mexico, and I spent our time there trying to navigate and discover our place in the world, environmentally, socially, how we are citizens of the world, and how we can be an effective citizen of the world. Each day, as you know, as you remember, was divided into a theme. One day was Day of Environment, one day was Day of World Poverty, one day was Day of Education, and so on and so forth. You know, I remember on the last day was a day of this action. We used to ask the students, so how are we going to change? And again, the program was remarkable. I don't know how we, because we literally saw the change that was taking place in students. It was like butterflies, you know, coming out of the cocoon, you know, and some would just amazing in front of our eyes. It was really, what a privilege it was to see people suddenly get it, you know, on the day 3 or day 4 of this program. But I remember on the last day, it was a day of decision making, and then every year we used to say, okay, what are we going to do? And people had ideas, but really in Danville, we didn't have any platform to implement those ideas. You know, I remember we were talking about going to Tim Horton, for example, and getting to buy fair trade. But other than that, there was no platform. There was no platform to make our students to come together to create a nucleus to make a difference. So basically, my teacher was the program, because every year, in order to make the global literacy more and more better, we have to study, we have to understand the world, we have to understand ourselves, how we are responsible in this world. So in 2010, we started an organization called Shared Harvest Community Farm, which was a farm. Originally, the idea was to offer a place where people can access healthy food at very low prices. So basically remove the barrier for individuals to have healthy food for low prices. So this is 2010. And so Shared Harvest has now grown and offers many programs. It's the only organic farm in town, but also with the help of a group of people, again, through Dream Program and our students, a group of people who helped us to devise a program called Let's Eat Right Dunville, in which people would get organic produce at 1/3 of the prices that they would get in the supermarket. But again, just like my experience with the medicine, whereas out of 10 people who are going to lose their leg, 1 or 2 would change and change their diet in order to save that leg. 8 go ahead and get their legs amputated. It was remarkable. Even that food was being given away at 1/3 of the price of what it is at supermarket. We had very little, like this year, for example, we had only 3 people who signed up for it.
Wow.
Wow. It is wow, So one thing is have the right intent to do right things. The other thing is that it's very difficult when you ask people to do something that they're not familiar with. If those 3 people who are buying the food, of course, they know what to do with the food. So most likely they're eating a lot of plant-based food, right? But unfortunately, the others who can benefit, maybe at the first year in 2011, when we started this program, 40 people signed up. And very quickly, most of them dropped out. And the reason they were saying that we don't know what to do with the food.
Right, exactly. Because a lot of people are not used to cooking that. They don't even know what some of these vegetables are. Mm-hmm. And so then when they get them in the box, they're like, what do I do with it?
Exactly. So then we started the cooking classes. We started frugal chef program, young chef program, in which we try to help the families and the students to learn, and again, the problem though is that anytime we offer these programs for free, it's well attended. But the minute that we put a little charge to cover the cost of food, the program is not as well accepted as when it was for free. So these are the barriers. So we continuously have to do fundraising to have the finances to be able to offer these programs for free. So these are barriers that's there that, all well-intentioned programs, it might not be accepted if it's too far away from the norm of what people do. And one thing I can tell you is that the norm of what people do is not eating a lot of plants. Maybe your audience does, but the people that I'm dealing with, they're not, so, and I can see it in...
And it's a challenge. And I know myself, I've been off and on plant-based. So now it's just over a month now that I haven't had any meat or dairy or eggs. So basically a vegan diet for over a month now. But I know it's challenging. I feel like some people need some hope here, some small steps. Like I always recommend if it's too daunting, start off with a meal, start off with a day.
Absolutely. That's right.
Maybe you can talk a little bit about some of the small steps that people can take.
So after our experience with, what we did is that, after our experience with little change that, because again, you have to remember, we live in a small community. So you have to remember a lot of people that were taking these courses were my patients. So actually, not only I used to see them at the Young Chef program or Frugal Chef program, or we actually had plant-based vegan chef program also. But also I used to see them in the office as my patients, and I knew who was embracing it and who wasn't. Again, that ratio persists. 1 in 10 would take it on, and 9 in 10, they would keep the recipes and not follow through with it. The second thing that we noticed is since 2008, we noticed a sudden rise in the number of people who were having heart attack and stroke, mostly heart attack in Dunville in their 40s and 50s. That was something new. I'd never seen that before. I was working in our emergency room as well as my office. It's not without exaggeration to say every day we used to have one person that you had to be transferred to Hamilton to get a stent put in. And they were in their 40s and 50s. And that, again, was something completely new. Back in 2004 or 2000, we didn't have that. But starting 2008, suddenly all the 40, 50-year-olds starting to have heart attack and stroke, and mostly heart attack. We decided that, maybe we cannot change people's cooking habits, but what we can do is that maybe offer them choice as when they want to eat out. And that resulted in another program called the Minga, which Minga means coming together for common good. So we started this 3,000 square foot community center in the heart of Dunville, that 1/3 of it is dedicated to a cafe or restaurant, which is for takeout only. I mean, not for takeout, it's like a fast food place, not really a full-fledged restaurant, but it's all plant-based. And the idea
happens to be one of my favorite place is my go-to for when I don't want to cook. I can just go and grab my meals there, and it's amazing.
Maybe without you, I would have to close the doors.
I know. I really think that I am supporting it. I'm pretty sure that we are the main supporters.
You are. You have been from day one. And I'm so grateful for our community, because here we are in a small town, Danville, and in a rural community. And we started a plant-based cafe that most people thought that we were crazy. But really, we wanted to address that awful statistics that so many young people in the 40s and 50s were getting heart attack, to offer a option, offer a choice. So rather than going and eating at other fast food joints in town, which, by the way, Danville has one of the highest rate of fast food places, but our Tim Hortons was always number one in terms of sales in something. I think I've heard that those numbers. We wanted to offer a choice, and remarkably, a plant-based cafe in Danville is thriving. We actually do quite well. It's busy and people coming in. There's lots of people coming and buying lunches. Food is very inexpensive. So I know we sell about 100 to 120 meals a day. So it's wonderful. I mean, it is wonderful, which I think that this 100, 120 people come through each day. Minga is not the end point, because some of those ideas are going to be practiced in their homes also, meaning that, they're going to, spend their lunch at Minga and maybe choose another day that they're going to either eat plant-based food that they learned, or to put together some salads that are meals that they learned from Minga. Because a lot of things that I cook, I know I've learned it from restaurants that I go to. So I'm very sure that.
What's your favorite plant-based meal?
I love Thai food, but really all the foods, all you have to do is change and add tofu to it, a mushroom or things like that, and then that becomes so pasta with mushroom, fantastic, But if you want a authentic food that's plant-based, I always found Thai restaurants are the best, you just go there and, everything can eat plant-based, and, the taste is always there. So we just love going to the Thai restaurants. I don't know. I mean, I know for Barbara and I, my partner and I, changed to, my mom would always laugh because I was a guy who wouldn't touch vegetable before February of 2012. I was a meat and potato guy, So it's really funny that February 2012, I've become a plant-based person. Not that I'm fully, I still eat occasionally chicken or salmon, but 95% of the time, maybe even higher, we only eat plant-based food. But our incentive was just watching documentary. I remember we watched a documentary. I can't even remember what it was, talking about, and one part of the documentary talked about how you can reduce your carbon footprint by 90% if you go to a plant-based diet. And the documentary said that half of our carbon footprint individually is from our diet. 50%, half of our carbon footprint. 25% is our shelter. 25% is transportation, and 50% is diet. And that 50% can be reduced by 90%. That's 45% overall by just switching to plant-based diet, And in February of 2012, Barbara and I looked at each other and said, okay, I think that is, and again, that's what I'm talking about. Once you can actually measure something, it becomes a lot easier to do it, So, when someone said, you can reduce your carbon footprint by 45% overall if you go plant-based diet, it was like, okay. So February 2012, I watched that. I can't remember which documentary it was.
I feel like it might have been Food Inc. Was it Food Inc?
Maybe. I can't remember which part of it. But we just look at each other.
So many good ones out there.
They all have the same message, But again, and that's what I was talking at the beginning of our conversation, that the way our human we are wired. First of all, we have to be authentic. I have to decide on my own that I want to be a plant-based diet. I cannot tell you should become plant-based. You have to make that decision yourself, and you have to do it through reflection. So that authenticity about the decision making is really important. But once that decision is made through reflection, the next step is to be able to measure it, and you can measure it again. We talked about measured, through environmental protection or stewardship, measured through financial, and also measured through your social impact. So once you open the door and become a plant-based diet person, then when you look at those three things, suddenly you realize that you're touching all those factors. As a plant-based person, you reduce your environmental impact through carbon footprint by 45%.
I think just, the fact people are doing better for the environment and, there's less the animal cruelty part.
Okay, yeah, right. You have happier cows and happier chickens because they can be cows and chickens and not be a meal. Financially, well, it was just crazy. We had someone over for a week and this person had to eat chicken. I remember I went out to buy chicken and 2 pieces of chicken cost $15. And meanwhile, I bought all these other food, vegetable, from supermarket, all organic, and cost me like $10. And I was just amazed. It was shocking to me that how 2 pieces of chicken, which would be maybe 2 meals, will cost $14, $15. So again, that's the financial part, right? So that's a financial incentive.
I think that might be some of the reasons my kids have switched to a plant-based diet. Mama and Papa aren't paying for their food anymore, so they're starting to realize.
Well, I'm very happy for them. That is wonderful. Again, for us, was those consideration. So that's what I think it has worked for us. Maybe it's going to work for others also if they go through those steps: authenticity and also measuring it. Measuring it.
That's a great place for us to end that. Those small steps that you can take. Doing that reflection, making those decisions, and then measuring part 2. Remember, for your health, you simply go to a doctor and start measuring your blood work and seeing those numbers go down.
Oh my gosh, absolutely!
Such an incentive.
Thank you for saying this, because again, I want to tell you, anyone with high cholesterol, the total cholesterol, these are my, from my experience, your total cholesterol drop by 50%, after 1 month of being on plant-based diet. So you can actually measure your total cholesterol and then go back 1 month later and measure it again, and you see the number will be halved. So these are my experiences.
I think you've had so many cases you've been able to see, and I really wish that my dad had been exposed to some of this stuff sooner. We probably still have him around. I know he was a big meat and potato guy, but he was also a grilled cheese a day guy. He loved his grilled cheese for his snack, but again was outwardly looked very healthy, was, marathon runner and climbed Mount Kilimanjaro, did all these wonderful things, but on the inside was not healthy at all. And I think that again is one of those disconnects where people aren't realizing what's going inside their body and how it's affecting. So wonderful to talk to you. I appreciate your time. I know you're a super busy guy. You've done amazing things for our community. I love that we were able to connect and learn from each other, all these things that we've done. And I can't wait to see the evolution, because, you started with the DREAM program, you went to Shared Harvest, you went into the Minga. What's going to evolve out of the Minga? So I can't wait to see that.
Well, we're going to be doing it together. So Debbie, thank you. Thank you for your friendship all these years.
Happy to be a part of it. Thanks so much. I appreciate your time and forward to seeing you soon.
Thank you for listening to Start Small. I hope you enjoyed today's episode and found a small step you can take today. Make sure you share it with a friend. And if you have not done so yet, make sure you hit the subscribe button, and if you are enjoying this podcast, consider taking a moment and leaving us an honest review in your Apple podcasting app so more people can be inspired to take small steps towards social impact.